Hello, everybody, and welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a naturopathic physician, and today I was going to talk about Marma therapy and first aid. Specifically, Marma therapy, you can also consider that the Ayurvedic energy points. And the first aid I'm going to talk about today is specifically for gastrointestinal issues. Okay, and before I get into the talk, I just wanted to thank everybody for all the different ways that you support my work in the channel. People who are subscribing and liking and sharing videos, sending in donations, asking questions, posting lovely comments, also, writing about when videos I post are helpful to them in various ways. So all that is definitely appreciated, and I want to thank you for that. So thanks so much. Note beforehand, before I get too deep into the talk, the information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It's always best to determine the root cause of any disease and to develop a comprehensive treatment plan. Again, when you can, usually first aid might be a little bit of an urgent care situation. Um, Individual cases can vary in terms of treatments that are most effective. Solo therapy, such as Marma therapy, may not be appropriate or effective in all cases. Marma therapy is not always appropriate in urgent care situations. For example, if somebody's been in a really horrific accident or something like that, and they're broken bones and bleeding and all this sort of thing, it may not be the time to implement Marma therapy. Um, there is a contraindication for Marma therapy. Any exacerbation of pain or a condition. It's not that the Marma therapy necessarily is causing a problem, but the thing is that you can use Marma therapy as a diagnostic. So when you touch a certain Marma point, and if that elicits pain, that's usually an indication that there's already imbalance in that area or in that system. Okay, and so, but we certainly don't want to cause any more, you know, instability or disruption when somebody's not feeling well. Okay. The other thing is that it's usually better for the person who needs the aromatherapy to self-administer it if they're able to. Um, the other thing is that if touch, for example, usually the marma points, you just touch very lightly. It's very gentle for the most part. If sometimes somebody might have a condition like hyperesthesia of the nervous system, where the nervous system is just very, very sensitive, and sometimes even the gentlest touch will exacerbate, whatever condition they have. So in that case, the person or the practitioner can send their breath or send mental energy to the point, because again, these are energy points here. So they're not touch points. Sometimes I hear people call them touch points. They're not touch points necessarily. We can use touch to stimulate them and to create more energetic balance, but we can also use other, non-touch methods. So keep that in mind. So again, if somebody's in some, God forbid, some horrific accident, and there's, bleeding, and you don't want to touch them and make things worse, if they're conscious and you can get them to breathe into certain places, or you can even send mental energy to them if they allow it, then you can stimulate the points that way. And the thing is that even if somebody is in, some sort of trouble, some sort of urgent situation, and you've decided to, and it seems like it's okay to try the Amarma therapy, you still want to call 911, emergency services, and you still want to get this person transported to urgent or emergency care facility. Okay, this is not to be used in lieu of or instead of these other things, because again, if somebody starts, maybe they seem, sort of okay when they're in the beginning, but they might start decompensating very quickly, and you want to make sure that they're in a place where they can be stabilized. Um, the other thing is that, these other facilities have other methods of determining what the root cause of the condition is. And as I mentioned before, that's a really important part of good medicine. The other thing is that, again, in any sort of urgent care situation, you want to maintain universal precautions and make sure that you're safe. Um, yeah, so that you don't, again, if somebody's bleeding or something like that, you want to protect yourself from any harm. Okay. Okay, so let's talk a little bit, give a little bit of background on aromatherapy. Marma therapy comes from Ayurveda, which is traditional Indian medicine, and Ayurveda is more than 5,000 years old. So this is a very, old, ancient therapy. It's considered an energy therapy. So again, you kind of have to wrap your mind around this therapy differently if you're coming from more conventional care, which is more of a biomechanical, kind of paradigm of medicine. This is more about energy. So in this system, people, diseases, states of health are seen as different kinds of energies and waves, and you can affect energy or these energies or waves through these 117 Marma points or Marmani, they're called in Sanskrit, on the body. Okay. So usually we use gentle touch. I do have a whole video on different techniques, most of which I do not use because some of them are, um, I don't know. I guess I try to keep things simple and pretty zen. But most people do really well, which is gentle touch. So just using gentle touch on these marma points, and again, I mentioned in the previous slide, you can also send your breath to these points or mental energy to these points to, again, because mental energy and kind of breath energy will also are also ways to rebalance the energies that these points are related to. Okay. So if you want more history on Marma therapy, you'll find that in my very first Marma video called Marma Points on the Hand. And I have a whole complete course on Marma therapy, which is in my Marma therapy video playlist. So you can learn all 117 points, at your convenience, so whenever you like. The other thing is that I've created two videos. Two of the videos in that list are Marma Points on the Hand follow along video and Marma points for balance, rejuvenation, and stress. That's kind of like a daily tune-up type of video. That's also a follow-along video. So I have two different follow-along videos that you can watch, and you can actually participate and have your own experience of Marma therapy. Okay. The other thing is that I have a whole playlist on Ayurveda, which is the broader context in which Marma therapy, is used. So if you want to learn more about Ayurveda generally, there's a whole playlist there. And I have actually also created, because you might be thinking, well, what's the difference between Marma therapy and acupuncture or acupressure? I've actually created 3 videos comparing Marma therapy to traditional Chinese medicine, acupuncture, and acupressure. So you can check out those videos if you're wanting to understand the similarities and differences. So there's medical philosophies of Ayurveda and TCM, traditional Chinese medicine, Ayurvedic perspective on pain, and also techniques of Marma therapy. Okay, so you have a lot of videos for a lot of background and details on anything that's interesting to you. But let's get into more of today's specific talk. Okay, so since we're talking about gastrointestinal issues, again, you can't really, it's a little bit sort of mechanical to just think about the Marma points and, oh, if you push this Marma point or press this Marma point, then it'll have this effect or whatever. But you kind of want to understand from a Ayurvedic perspective what the kind of energetic physiology is, what's really going on. Okay, so in Ayurveda, there are essentially 3 major conditions or imbalances, or they call them doshas. One is vata, or you can loosely translate this as wind energy, pitta, or you can loosely translate this as fire energy, and then kapha, which you can loosely translate as earth energy. Okay, so when you have a vata condition, wind energy is predominant in the abdomen, then you'll see certain kinds of conditions pop up. Okay, so you'll have intermittent pain, just like the wind comes and goes. You'll have pain that comes and goes, and this tends to be kind of like a crampy type pain. Okay, also gas and bloating, because again, gas and bloating, it's a lot of gas, a lot of air. Constipation, because constipation is when the bowel becomes dry and it's hard to pass a stool, and the wind is very drying. Also, slow peristalsis. So, when there's an imbalance of wind, sometimes you'll get like all the subtle, smooth muscle that kind of creates a peristalsis. If there's kind of like almost like a paralysis of that, you will get slow peristalsis or movement of food through the GI. So, like for example, a lot of the new kind of weight loss drugs that are being used. There's a lot of GI issues associated with them. And the thing is, like, weight loss is generally considered to be like an increase in vata, because vata is light. But the thing is, you'll get a lot of people with like peristalsis, gastroparesis, like their stomach isn't emptying, or they're getting constipation, stuff like that, because not only the wind is helping them lose weight, but it's also drying out their GI. Okay. Somebody has no or low appetite, because again, when there's a lot of wind, it can blow out that kind of agni or fire energy that you need to, like, burn up and transform food. Um, and the thing is, wind energy is cold and dry and rough. So windy vata conditions tend to be worse when somebody's eating cold, raw, dry foods. So, okay. Then you have pitta or fire energy. So typically related to pitta, you'll have people with sharp pain, inflammation, burning, nausea, vomiting, bleeding, diarrhea, because these are all kind of conditions where there's like intensity and there's fire, and bile and that sort of thing. Um, and this is going to be a fast peristalsis. Like that's why people get diarrhea, because the food's moving through the GI so quickly it doesn't get, digested properly. And somebody with a pitta type energy usually has a high appetite because their, gastric fire or a digestive fire is so high, like they just keep burning things up. Um, like typically, people with a pitta, high pitta, they'll end up with diseases like hypoglycemia, where they just burn through sugar so fast that their blood sugar plummets. Pitta conditions generally worse with foods that are hot, spicy, acidic, sour, and fried. Um, yeah, because all those things are intense and stimulating, but not necessarily in the way you'd want if you have too much fire or pitta already. And then there's kapha or earth energy. And with kapha, you'll get people who have like a dull or achy pain. They'll get bloating, but not from gas like the vata people will. They'll have bloating from fluid. Uh, They might also have constipation as well, because a kapha energy is very solid and steady. It's not very moving. So most of the constipation I see, though, is actually from people who have too much vata, so they're eating too much cold, raw, dry food or not hydrating enough. Kapha people can also have a slow peristalsis because, again, earth does not move very fast. But they'll have a medium appetite. So they won't be so low in appetite the way vata people are, but they definitely won't be high in appetite like pitta people are. And then they tend to be worse when they eat heavy, sweet, creamy, cold foods, because those sorts of qualities are similar to the earth, right? Because the earth is heavy and it's wet, that sort of thing. Okay. So on the right here, just a few different general ideas. Again, if you're going to try using Marma therapy for, an urgent care kind of gastrointestinal issue. First of all, is that when you have any sort of acute illness or injury, this will usually be primarily a mix of vata and pitta, so wind and fire, because wind and fire are moving and they're also unstable. Okay. So, like you can think of, again, if somebody's in an accident or something like that, it's not really a time of stability, right? Bones are getting broken, people might be bleeding, they might be unconscious or unsteady. So, not a lot of solidness, not a lot of earth energy at that point. So again, you'll see in this talk, I mean, just for gastrointestinal issues, there will be many points to choose from potentially. So typically, I suggest people choose points close to the problem, wherever the problem is. Like, again, since we're talking about gastrointestinal problems, if, for example, somebody has some pain in the upper, GI, like around the stomach, you might want to choose points there, if that's possible. Okay. If that's not possible, like maybe somebody um, has reasons, that they don't like their stomach touched, or it's not possible to reach that point, or it seems, socially invasive, or for whatever reason, then you might choose a point farther away from where the problem is. Okay. The other thing is that, as I mentioned, when you use these Marma points, you should not be causing additional pain or discomfort. Again, it's not that typically the Marma points cause problems, but the thing is, the Marma points can be used diagnostically to show where problems exist. So again, if somebody's very unstable, um, like even if they have something like nausea or vomiting, I know for myself when I've felt nauseous a few times, sometimes I'll put my hand in on Marma points close to that area. Sometimes that works, but sometimes the area is just too sensitive because there's too much imbalance already. And so what I'll do instead is I'll just take slow, deep breaths, and that usually does the trick. Okay. Again, with these Marma points, especially in urgent care conditions, situations, because we're talking about Vata and Pitta energies, because they're already kind of extreme, Vata is kind of extreme with movement, and Pitta is very extreme with heat. They both tend to do well when you give a moderate, gentle, kind of more comforting, warm and fuzzy type energy rather than intense or long or extreme or anything like that. So for example, like if you were working with a Marma point on somebody's hand, you might just gently hold that Marma point, but in a way where like you're holding their hand and they don't even realize that you're doing Marma therapy. Because just even that sort of, comfort, even if you're not specifically touching a Marma point, just gently holding somebody's arm or hand or, gentle hand on their leg or something like that. That in and of itself can be very comforting during a period of high Vata Pitta. Okay, because Vata and Pitta, again, both for the most part, Vata really needs to get grounded and Pitta really needs to cool down. And as I mentioned, you can always use mental energy or breath instead of physical touch to work with these points. Okay, so what I'm going to do is, because again, there are Marma points all over the body, and what I'm going to do is I'm going to go through kind of a review of different main locations of Marma points that are helpful with gastrointestinal issues. Okay, so I'm going to review the location of the points, and then I'm going to put up a list of gastrointestinal issues and specific points you can use for the specific issues. Okay, so let's start with the abdomen and chest. So you can see in the middle here, down the midline of the chest, we've got these 5 circles here. Okay, so the top one here, this is the only chest point that's kind of used much for gastrointestinal issues, and it's called tritium, and it's kind of at the level of like third, fourth intercostal space, right in the middle of the sternum. And then below that, straight down, you'll get to Agropatra. Agropatra is on the um, what do they call it? Xiphoid process. Okay, so there's a little kind of tail. I think of underneath the rib cage. You don't want to press on this ever too hard because you can actually break that off. Like some people will break that off if they do CPR. But just kind of right below, again, if you touch like right below, before you get to any soft tissue in the abdomen, straight down, that last bit there, that last jump off point, that's Agropatra. Okay. Then if you go to the belly button, I'm going to skip down one. If you go to the belly button or umbilicus, this is called Nabi. Okay. Now, in Marma therapy, they usually just call it Nabi, but you'll see we have Nabi 1, 2, 3, and 4. This is sort of, you can think of it as Nabi 0. So it's sort of like Nabi home. This is the main Nabi. Okay. Now we're going to back up here, and you can see I missed a red point here. This is called Surya, which translates as sun in Sanskrit. And Surya is midway between Agropatra and Nabi. Okay. Then below Nabi, another red point. Again, all the red points are down the midline here. We have another point called Basti. And Basti is between the midpoint between Nabi and the pubic symphysis. So that kind of front of the pelvis. Okay. So those are the points down the midline. Then then let's look at the points on, above the umbilicus. So the first 2, which are, a couple ribs down and kind of more lateral to Agropatra. These two are called Funkri, and there's two of them, one on the right side, one on the left side. So they're a couple ribs lower, and then again, but they're going to be on that ridge. Like you'll be able to feel these on the ridge of the ribs as they're kind of folding down and around. Okay. Then below the Vankri, these 2 points, if you keep following the ribs down a little bit lower, a few more ribs, you'll get to 2 points. One is called Yakrut, and directly opposite on the left side is Pliha. Yakrut means liver, and Pliha means spleen. Okay, so we have the liver and spleen points. Okay, but they're a pair basically. I mean, they have different functions, but you can kind of think of them as a pair when you're trying to remember the location of these Marma points. Then, if you follow the ribs, you follow that curvature of the ribs to the side, okay, of the abdomen, you're going to get to 2 points. These are called Parshvasandhi, and there's two. Again, one on the right, one on the left. Okay, so again, you've got these 5 points in the middle. Then you've got the 2 Vankri, the Pliha Yakrut pair, and then the 2 Parshvasandhi. Okay, then in the middle abdomen here, so you have Nabi 0 in the middle, right at the belly button. And in a square around Nabi 0, you have Nabi 1, Nabi 2, Nabi 3, Nabi 4. Okay, so Nabi 1 is halfway between Nabi 0 and Yakrut. Nabi 2 is midway between Nabi 0 and Pliha. Nabi 3 is halfway between Nabi 0 and Lohita, this blue spot here, which I haven't talked about yet. The 2 blue spots are called Lohita. They're right on the inguinal canal. Okay, kind of at the sacroiliac crest, close to that. So there are 2 Lohita points, one on the left, one on the right. So again, Nabi 3 is halfway between Lohita and Lohita on the right side and Nabi 0. And Nabi 4 is halfway between Lohita on the left side and Nabi 0. Okay, so in my mind, I keep thinking of these as like upper gastric, upper abdominal Marma points, mid-abdominal Marma points, and then again these Lohita points, again sacroiliac crest, and then halfway down between Lohita and again the pubic symphysis. And I don't have the pubic symphysis on here, but you can imagine it. Again, that's going to be in the middle below Basti, another red point below Basti. You can think of it that way. There are 2 Vankshana points, one on the left, one on the right. And Vankshana is halfway between Lohita and pubic symphysis, one on the right, one on the left. Okay, so just a basic review of location of points. Again, all these points, I have gone into detail of everything that they cover and the energies that they're associated with, Ayurvedic energies and all this kind of stuff, in 4 different videos. So one is a chest video and 3 abdominal videos if you want to get into more beyond, the basics of the gastrointestinal stuff that we're covering today. Okay, so now keep this anatomy in mind. Then, okay, so here's your list. So this is GI issues on the, left here, and Marma points from the abdomen chest that you can work with to help ameliorate GI issues, like in a first aid type of way. Okay, so let's look at the issues and the Marma points. So the first issue is just pain generally. So you can see we have Nabi 0, Surya, and Basti. These are 3 points, red points in the midline of the abdomen. Nabi 0 at the belly button, Surya is above it, and Basti is below it. Okay, so when you have pain in the upper GI, try Surya. When you have pain generally, in the midgut, Nabi 0. When you have pain in the lower gut, Basti. Okay, you can also, again, any of these Marma points are good for pain. So if there's a specific region, like maybe it's like the left side or the right side or near the liver or near the spleen, then you can use those points as well. But I wasn't going to list all of them. Okay. Now, other potential issues like loss of appetite. You could work with Agrapatra, Surya, Nabi 0, and Vankri. Now, again, Agrapatra, Surya, and Vankri are, epigastric, so they're above the umbilicus. Okay, and most of these are related to like there's like a fire pitta type energy there. So again, if somebody doesn't have much of an appetite, it can stimulate appetite. Then if somebody has weak digestion, maybe it's slow because of kapha or maybe it's slow because of vata typically, you can similarly work with agrapatra, surya, nabi zero, vankri, and then now we're adding in yakrut. Because yakrut is so, the liver is creating so many and producing so many enzymes to help break down food. That's really key there. Okay, then we have this kind of mix here of nausea, vomiting, acid reflux, gastritis, and peptic ulcer. Now, the similarity here in terms of Ayurveda is that most of these are related to a high level of pitta because there's so much acid in the stomach. Mhm. Now, if you look at the points that you can work with to help with these conditions, we've got tritium, so the one that's right over the midpoint of the sternum. And then we have agrapatra, so again, the xiphoid process point. Surya below that. Yakrut, the liver point, Nabi 1, which is between Yakrut and Nabi 0. And then Vankri, so again, the upper gastric points. Not necessarily pliha. Pliha is more of a spleen point, but you can see kind of the relationship between the position of the points and what, again, I usually tell people start with the points that are closest to what you're dealing with, if possible. Okay. Then the next condition we have here is bloating. And you can see we've got Nabi 0, Surya, Yakrut, Pliha, Lohita, and Vankshana. So these are kind of all points, Nabi 0, Surya, those are, midline, Yakrut, Pliha. So we've got, again, these are kind of more, they're lower than, say, Agrapatra and Lohita and Vakshana. So those are going to be like the lower, the GI points. Okay, then something like irritable bowel syndrome, you could use NAB 3 and NAB 4. And also inflammatory bowel disease, you could use NAB 3 and NAB 4. Now, again, these have different etiologies, right? Irritable bowel syndrome is usually a diagnosis by default when they can't find anything else on a lab or something like that. Inflammatory bowel disease is actually an autoimmune condition, okay? But you can see NABI 3, if you go back to the previous slide with the location of the points, NABI 3 and NABI 4, those are below the umbilicus. So these are going to be lower GI points, okay? Because now you can see, nausea, vomiting, acid reflux, this is all stomach. And now irritable bowel syndrome and inflammatory bowel disease, these are going to be like, you know, small intestine, large intestine type diseases. Okay. Then similarly, you can see where we're going now. You can see that essentially the points are following, the location. The location of the points is following the location of the uh, issues, right? Then we've got diverticulosis, right? So when there's issues with the colon, kind of bulging kind of a anatomy and the tissue there. Again, you can use NABI 3 and NABI 4. And then things like diarrhea and constipation, you can use NABI 3, NABI 4, and also functional. Okay, so we've got more points though, so hang on. Now, I started with all the points, nearest the GI, you know, uh, so those are going to be probably the most obvious, but again, you may not always be in a position yourself. Like maybe you're out in public. Um, Sometimes you can like, put a hand on your belly in public and nobody would notice, like maybe under a coat or jacket or something like that. But, um, in some cases, it might be easier to work with other points and other locations. So now what I'm going to go through is I'm going to review location of Marma points, the Marma points that, can be used for GI issues. And this is going to be, on this slide, I'm going to cover face and head points. And again, this is if you want details on these points and all the other things that they cover, because most of these points cover multiple issues. These points come from 5 different videos on the face and head. Then on the next slide, I'm going to go through points on the neck. So basically, the next 2 slides are face, head, and neck points, and I'll go through the list of conditions. All right, so just to review again, location. Let's start, let's start at this yellow star here. I didn't, the head doesn't go up far enough. Okay. But this point on the midline of the head, at the top of the head, so if you touch the top of your ears and go straight up to the midline of your head, that point at the top of your head, the midline, is called Murdani or Adipati. Okay, so top of the head, midline with top of the ears. Okay, this is one point on the top of the head. Okay, and the rest of these are on the face. So then you can see it kind of the edge of the eyebrows, or actually more in the temple region. So a little bit back from the eyebrows. There are 2 points here. These are called shanka. Again, there's 2 of these, one on the left, one on the right. Okay, we've got 2 points on the eyes. So in the inner corner of the eye, left and right, there are 2 of these. There's Aninaka. Then right below the pupil underneath the eye, there are 2 points, left and right, called Madhya Vartama. Okay, then on the nose, we have 1 point right at the tip of the nose. 1 point, this is called Nasya Agra, end of the nose. Then we've got a few points around the mouth. So above the lips, both lips, we have a point called Oshta. Below both lips, we have another point called Hanu. And then kind of to the side of the lips on either side, there's 2 of these. This is Chibuka. So 2 Chibuka points, one on the left, one on the right. And then if you go from Chibuka and you kind of follow your cheek up and back, and you'll kind of see there's like a divot there. If you kind of, close your lips and go from the corner of the mouth and kind of sweep up and back, then you'll feel this kind of midpoint in your cheek where like you can touch your teeth, but you're starting to get in the jaw. Yeah. So that's called Kapala Madhya, and there's 2 of those, one on the left and one on the right. Okay, so those are your face points and one head point. Then on the next slide, the neck points. Okay. So again, we have this yellow star because there's a point you can't really see on this picture, but there's a point called Manyamula, and where it is, it's actually in the back of the neck. Okay, so right under the base of the skull in the back. That's why there's a dotted line here, because it's sort of hidden. But again, on the midline of the spine, there's a point there called Manyamula, called root of the neck. Okay. Then on here, kind of like on the chest and the abdomen, we've got 3 points down the midline. Okay, we have Kantha, which is right above the hyoid bone, where, like, if you kind of follow your neck down and you swallow, it's kind of right above that, but like for guys who have a really prominent Adam's apple, it's like above that, maybe a third way down is about where the hyoid bone is. So this is called Kantha. If you follow Kantha straight down into that little divot, this little V you can see here, where the clavicle meets the rib cage and stuff like that. This is called Kanthanadi. Okay, so there's 1 Kantha, 1 Kanthanadi, 1 Manyamula. Then if you go from this divot, Kanthanadi, down, so now you're on the chest. Okay, right below that divot. This is a point called Jatra, and there's only 1 of those. Okay, so we've got Manyamula in the back, right below the skull, in the back, on the midline. We've got Kantha, Kanthanadi, and Jatru down the midline here on the front of the neck. And then we've got these 2 points on the side. So Mantha is at the same kind of parallel location as Kantha, but now with Mantha, you're on the anterior portion of the SCM, so sternocleidomastoid muscle. So this kind of big rope that ties the clavicle to kind of the back of the head. Yeah. And so like when you twist your head, it'll usually pop out. Okay. So Mantha is about a third of the way down SCM, sternocleidomastoid muscle. Okay. Then we've got, and there's 2 of those, so 1 on the left, 1 on the right. And then we've got this akshaka point, which is on the posterior side of the SCM. Again, there's like a little divot there. Okay, this little light blue point. So down where the SCM is connecting with the clavicle and the rib cage. Okay, so there are 2 of these, 1 on the left, 1 on the right. Okay, so again, try to remember this anatomy as we go through the next chart. Okay, so here we have GI issues and Marma points on the face, head, and neck. Okay, so again, you can see most of these conditions are the same. There's a long, shorter list here, as you can see. And there's less points because, again, most Marma points, they're mostly effective for local areas, but you do have other options here. But we also have down here hemorrhoids, so that's a new condition. Okay. So for weak digestion, you can use Shanka, so the temples, Madhyavartama below the eyes, Kapala Madhya, like right in the cheeks, Oshta above the lips, Chibika side of the lips, and Manyamula, so back of the skull, below the skull. Then we have nausea, vomiting, so Burni, top of the head, where you pick the top of the ears, go to the midline above the head. Then we've got Mantha and Akshaka from the front of the neck. Acid reflux, we've got Shanka, so again, temples, Kaninaka, the inner corner of the eye. We got Kanta from the neck, Kanta Nadi, so these two, and Jatru, so Kanta Nadi, Jatru down the center of the neck, all for acid reflux. Then for gastritis, peptic ulcer, we've got Shanka again and Kaninaka, so temples and inner corner of the eye. Then for inflammatory bowel disease, we've got Kapala Madhya, the cheek, diarrhea and constipation, Kapala Madhya, the cheek. And then for hemorrhoids, we've got Nasya Agra, the tip of the nose, and Hanu, the chin point, right below the lips. Okay. Okay, so this is going to be the last set of points that I review and talk about related to gastrointestinal issues. And these points are on the arm, the hand, and the leg. Okay, and these points are from 4 different videos. So upper arm, shoulder, elbow, hand, and knee. Okay, again, if you want to find out more about these points and more details and what else they're good for besides gastrointestinal stuff, you can go to those videos. But let's start over here on the left on this arm here. So this kind of a green point in the belly, in the middle belly of the, oh geez, totally blanking on the English name. The biceps there. Jeez. So, so funny. Anyway, so right in the belly of the biceps here, this is called Bahu Urvi. Okay. And there's 2 of these, one on the left arm, one on the right arm. Okay. Then we've got a crease in the middle of the arm, the popliteal fossa. Okay. Um, and so about a finger or two, a finger, 1 or 2 anguli, that's another Sanskrit name for kind of a finger width. Below this crease here, there's another point right in the middle here and this point is called Bahu Indrabasta, and there's 2 of them, one on the left arm, one on the right arm. Okay. You don't want to be in the crease because then you might be cutting off circulation. That's typically where people, phlebotomists will draw blood and stuff like that because there's a pretty big vein that runs through there, and also some nerves and stuff. So, yeah, a little bit below the crease here. So those 2 are on the arm. Then on the hand, there's 3 points. So on the wrist, there's 2. One is Manibandha. Okay, and there's 2 of these, one on the left arm, one on the right arm. So this sort of pink point here. And this is kind of, if you go to the mid points on the anterior surface, so the kind of the anterior surface of the hand where you're kind of coming up to the hand. There's like that crease, another crease there. But instead of in the midline, you actually want to go to the outer portion a little bit. Okay. So you can see there's like a little notch there on the corner of the hand. Yeah. So that's going to be, if you, or you could, you could do it that way, find it that way, like get that little corner of the hand and kind of go up and around. And you'll see that it kind of almost takes you to the middle of the hand wrist, but not quite. That's your point. Okay. It's called money banda, and that's where they use that. I think they use that term if I remember correctly, like where your bracelet kind of sits. Kind of thing. Okay. So 2 points, one on the left, one on the right, money banda. Then another point on the wrist. This is called Korchakshira, and this is where you can see where the thumb is there, kind of pressing. This is on the side of the hand. It may not be completely obvious where the point is, but it's on the side of the hand. It's not actually on the points of the wrist. It's on the side under kind of point. If you go down and out to the side of the wrist, that's your Korchashira point. And again, there's two of these, one on the left hand, one on the right hand. Then we've got Tarjani. This is on the index finger, pointer finger. And again, where the thumb is covering. So that red point is actually, if the thumb wasn't there, this would be in the midpoint of the base of the nail on the index finger. That's Tarjani. And again, two of these, one on the right hand, one on the left hand. Then there's one point on the legs. This is called Indrabasta posterior. And again, don't confuse this with Bastu Indrabasta. Bahu Indrabasta. Okay, because if I remember correctly, there's three on Indrabasta points. So Indrabasta posterior, there's two of these, one on the left leg, one on the right leg, and this is right in the belly of the gastrocnemius. It's right in the middle of the calf muscle. Okay, so we've got 1, 2, 3, 4, 5, 6 points on the arm, hand, and leg related to gastrointestinal stuff. So let's look at the table. Okay, so weak digestion, nausea, vomiting, acid reflux, peptic ulcer, gastritis. So you can see all this kind of upper GI stuff. Bahu urvi you could use. Okay, and that would be, again, that's like the, if you gently put your hand on somebody's biceps, in a very comforting way, they wouldn't even necessarily know you're doing Marma therapy. Although I wouldn't, be sneaky. That doesn't go very well typically. And then you see here irritable bowel syndrome. We've got Bahu Indrabasta, so that point below the crease in the arm, and then Indrabasta posterior, so the point in the middle of the calf muscle. Then inflammatory bowel disease, you could use Bahu Urvi, Bahu Indrabasta, so the 2 points on the arm, and then Indrabasta posterior, the point on the leg, on the calf. Okay, then diverticulosis, Bahu Indrabasta, Harjani, so the index finger point, and then Indrabasta posterior. So you can see a lot for, clearly with Indrabasta posterior, this is a big point for like the colon and lower GI. Then diarrhea and constipation, Bahu Indrabasta, Harjani, and then Indrabasta posterior. And then hemorrhoids, this is where you get the wrist point. So Manibandha, Korchashira, and then Indrabasta posterior. So you can see almost any kind of lower GI issue, this Indrabasta posterior on the calf is really important. And then the Bahu Urvi and the Bahu Indrabasta on the arm, those two on the arm are really important. And then you've got a couple extra on the hand or on the hand, wrist, Chardonnay, Korchashira, and Manibandha. Okay. So there you go. Marma points, Marma therapy for first aid and gastrointestinal issues. As always, I appreciate you stopping by and listening to one of my talks. I do have another YouTube channel called Light Vedic Astrology, where I talk about Vedic astrology or ancient Indian astrology. Jyotish is another name for it in Sanskrit. So if you're into Vedic astrology, that might be interesting to you. But as always, I hope you found this talk interesting, helpful, and useful for you, for your health and well-being. All right, so take care, and until the next one, namaste.